Welcome back to interview section. So today with us is Dr. Tany Thaniyavarn, MD, and he is an instructor. Sorry, is an instructor in medicine, Brigham and Women Hospital, Harvard Medical School. Am I right?
Yeah, that's pretty good.
Thank you
Welcome
so
ครับ
much.
สวัสดีครับ
สวัสดีค่ะ
สวัสดี
So
ค่ะ
today we have the number of infection people is 8,000 for the new cases, and yesterday, few days earlier, some people is have an argument on social media. So CEO of Pfizer said like the end game of COVID-19 will happen very soon, but WHO director not agree about that. So let's talk about the situation first. As you've seen right now, do you think like how possible the scenario are likely to occur?
Well, I think it's not why is it possible, or even if it is possible, we should be thinking of this as you have to be cautious about it. You can be optimistic about it, but you also have to be cautious because all these COVID, have surprised us so many times in the past, ranging from Wuhan variant, and then a couple of months later, then the Alpha, and then Delta, and then most recently Omicron, right? So these are pretty new things to us. So if you're thinking about Omicron variant being the end game of everything, it could be true because it's very highly transmissible, but then it has very low symptoms rate. When that happens, it could potentially be causing more of the endemic COVID. What that means is it doesn't mean it's not dangerous. It means that it is more predictable to us that how we're going to deal with these things. Now, there's no way to guarantee that in the next couple of months there will be no variants again. So that's very, very important because no one can guarantee. And we already know that the more the virus spread, the more it becomes more transmissible, and the more it makes a copy of its own self, the likelihood of mutation of the new variants to pop up increases, right? And it's true that Omicron variant right now is very, very highly infectious. And once it does that, then there's a lot of chance that this could cause another variant in the future. And we don't even know how the new variant is going to behave. So we have to be cautiously optimistic about all this.
What about the factor that people already have vaccinated already?
Well, it depends on it. I think it does help because we have a lot of proof. Initially, all the vaccine has been manufactured based on the Wuhan variant. And then there's Alpha, Mu, Beta, Gamma, Delta, and so on. And we have several proof that these vaccines are quite effective against the new variant as well. So when that happens in the future, I think it's also going to be very helpful. But the question is how helpful it will be, because we know that against Wuhan variant, most of the vaccine doesn't have any problems, right? But then with the Beta variant, which is known to be evading immune system that is built by all this vaccination, well, that's created a couple of questions to us. But we already know that it also been very helpful in reducing all these severe symptoms, including other symptoms such as long COVID or multiple system inflammatory syndrome, which we have seen, and that's far more dangerous than the COVID, and that's also preventable by vaccination.
Right. So let's talk about the topic long COVID. This is a topic that people are concerned right now, and some people say that it will affect people life for very long time, but another people believe that it's not that scary. So the question is what the truth is.
Well, first of all, if anyone who have experienced long COVID, they're likely going to tell you that that's no joke. That's pretty serious. The symptoms range from having bad memories, right? Your functionality might not be as good as you were before the COVID hits you. You may have insomnia, you may have anxiety, depression. These are just merely a simple symptom that just happen in these people, and they can be very devastating for their life. They might not be able to perform their work, and that's part of it. It also affects other systems, such as the lungs. You might have short of breath that lingers for a month and doesn't go away. You may have scars in your lungs. You may also have fatigue. Your sense of smell or taste may be altered, or it's never be the same again. So you can just imagine if there's a gas leak and you cannot smell it. That could be very dangerous to you, right? And nobody can tell you when all these symptoms going to go away. I have some patients who still complain of these symptoms for 8 or 9 months. And that's no joke, because nobody knows. These are very, very new. Each of the previous variant that we have seen, like alpha, delta, mu, gamma, or everything, all of these variants can actually cause long COVID. And Omicron is hard to say whether this is going to cause long COVID or not, because it just appeared back in November last year. And by definition, we say that you have long COVID when it is at least 3 months from the initial symptoms that you developed. So it's barely touched 3 month mark after November. So it has yet to be seen.
I just read the comment earlier that people said, like, when the media or doctor keep talking about long COVID, it's made people more worried and made people more panic. I saw you had a lot of content on the social media already that you're talking about long COVID. As a doctor, what do you think about that?
Well, the thing is, it's preventable. So we have proved that at least if you get the vaccine, you could reduce the rate of this long COVID by at least 50%. And long COVID, by the way, is quite common. It depends on which study you're looking from and which criteria they used in the past. It ranged from like 10% to 50%. So, 50% is one out of 2 patients will have long COVID, especially if your symptoms are quite severe. Let's say if you end up in the ICU having requirement for ventilators, breathing machine, or other invasive monitoring and other stuff, you have a high chance of developing long COVID. But it doesn't mean that if you have mild symptoms, you will not have long COVID. That's the thing. You might just be in the hospital, right? You might just be outside, or you do a home quarantine, but you can still have long COVID. We have seen those. And we have a lot of experience in this, like people who have disturbance in their sleep. They could not sleep. They have persistent insomnia. If that's the case, that could very well be something bad. People may regard as insomnia as something that's common and is not harmful, but it's not actually true. Imagine if you cannot sleep for a month. What happens, right? You cannot function. You might not be able to function well. Your memories might be messed up. If you're a driver, you might go into a car crash, right? So that's pretty dangerous to me. But the bottom line is preventable. That's the thing.
Gunana, do you have questions?
Well, I personally have friends who have the effect of long COVID, basically. And the person has really like a hard time to do his lifestyle, basically. I would like to ask, what would be your recommendations for someone who have long COVID? Because, of course, as you say, it's affect, how they work, it affects how they think. Even the lifestyles also change as well. And it becomes like, we don't know how long this is going to last. I mean, the long COVID, we don't know, but we would like to know, like, how are we going to live with it?
With the long COVID, there's 2 things that we have to act on. Number one is the person who have long COVID. There's no proven way of treating all these things, but the thing that you can actually do at hand is to do an exercise. So if you exercise regularly, that also, we know that exercise is good for your health. It boosts up your immune system. It also helps with your cardiovascular, which is your heart, your lungs, and your muscle and everything. And that improves everything that you're experiencing. And also, the thing that you used to teach your kids, right? Go to bed at the same time, go to bed early, wake up at the same time, or eat healthy, exercise. All those things that you teach your kids, they're good for you as well. So many of the adults, patients who have experienced all this long COVID, they forget about this, right? They think, well, I'm gonna sleep. I'm gonna go to bed at maybe midnight and wake up sometime in 6 o'clock and start working. Well, it doesn't work that way. You actually need like 7 hours of sleeps, or something like that. And you also need an exercise, right? If you don't exercise, well, a bunch of things gonna happen to you. Like if you get older, your body gets weaker, and if you have never exercised before, well, a lot of illnesses gonna catch up on you.
But is there any specific exercise for these people who suffer from long COVID?
Well, typically it depends. We always recommend aerobic exercise, at least 30 minutes a day, because that boosts up your immune system and the cardiovascular system as well. However, there's some patients who are so short of breath they cannot even do any of these things, but they have to try. If they never tried before, they will never get better. So that's the bottom line that they have to do. And moreover, we have some research that if you get long COVID and you've never been vaccinated before, if you get vaccinated after that, the long COVID symptoms may go away within a month. So that's very promising. But that research is based on the mRNA vaccine, which we have only 2 of them in Thailand, which is Pfizer's Moderna. But for the other vaccines, we're not quite sure. Actually, I take my words back. So for AstraZeneca, it's also happened in this situation as well. It's also helped with the long COVID symptoms. But this is for those who will live with long COVID, and also their peers, their family has to understand as well, because all these psychological systems are impacted, and they might be losing their memory. So all the other people around them have to help them. They have to understand. Now this is, I would call this tier 1, and tier 2 is about the policy. The hospital that discharged this patient, they have to risk stratify, because some patients are at risk for having long COVID, such as those who end up in the ICU. When they discharge this patient home, they have to set up some kind of follow-up with them to make sure they don't run into problems, or if they have certain problems that can be corrected earlier, they might prevent long-term effect of this long COVID. Now, I think this is also very important for the hospital administrator to do all these things and promote health and follow up on the symptoms.
Right. Is it possible that the vaccine, including booster jabs that we have so many now, some of my friends got 4, can prevent some symptoms of the long COVID?
If you get it before you catch COVID, yes, it reduces all these long COVID symptoms by 50%.
I see. Right. And the last question, Kun Ping? The next question.
Another question is like, is it possible that people have a long COVID that we don't have a good medicine one? Right now, it seems like we have only option favipiravir, and people have a lot of side effects for that. Do you think this is relating?
You mean the medicine causing all these long COVID symptoms?
Yeah, if we have, what do you think?
Well, I don't think
Can I ask you for the knowledge? Favipiravir is not kind of like a exactly medicine for COVID-19 treatment, right?
That is correct.
Understand. Yeah. So do you think is it because of about that?
Well, I don't think it's causing the long COVID symptoms. It may have side effects, but usually side effects are short-lived. Unfortunately, I don't have a lot of experience about favipiravir because we don't use this in the United States. However, based on some of the research, we know that it might not be that useful. However, if you start that early on, it might have some effect on the COVID. All of these medicine we use for COVID treatment are necessary because they're sick people, right? So we need to help them. They all have side effect. Everything in the world have side effect. They have good and bad things, right? But if it's necessary, you have to use it. but I do not think it has anything as a long-term side effect.
Right.
Right. It seems that you are now having a lot of followers, FC fan, Dr. Thani ครับ คุณขวัญจิต คุณมนทาทิพย์ and คุณจีดา said, Dr. Thani FC here.
Thank you very much.
Okay ครับ คุณปิ๊ง you have any last question or คุณนีน่า
Karina, do
Well,
you have any question?
I would like to ask, apart from favipiravir that you say that you don't use that much, what are the alternative medicines or treatment that you use?
Well, in terms of treatment, early on, there's a lot of viral replications in patient's body. So the treatment in this phase is to reduce the amount of virus as soon as possible. And then the second phase is caused by your body making a lot of inflammations. And the treatment for that is to tame down the inflammation so that the patient will not have organ damage. So we are talking about reducing the viral replications. How to do that? Initially in America, use remdesivir, which I think in Thailand they do have that, but it's injectable medicine. It's not like a pill or something that you can take at home. So that's a difference between remdesivir and favipiravir. We also have other two medicine that we use called Paxlovid and molnupiravir. Those are also can be taken as a pill, and that's given early after you have symptoms in those who are at risk for having severe COVID. So these are medicine that we use mainly to reduce viral replications. They have side effects as well. We also have something that you might have heard before. It's called a monoclonal antibody or cocktail, something like that. In Thailand, I think we do have a lot of antibodies in the United States, but in Thailand there's RegenCov, which is produced by the company called Regeneron. That's also a thing. But we know that this does not work against Omicron anymore. We currently use something else called sotrovimab, which I don't think we have that in Thailand yet. So
would there be any medications that some people dream of, like just sniff to it and it would cure everything?
I don't think we're that far yet. We do not have anything that we can sniff or inject one time and then the COVID's gone. It's not like that. It's more complicated than that.
Okay.
Now, one thing I would like to add is, apart from long COVID, which affects multiple systems in your body, you might have like every system you can think of, such as you might have upset stomach, you might have diarrhea, you might have persistent muscle pain, and so on. But also there are a subset of patients, like 10 to 20% after they're discharged from the hospital, that requires rehospitalization within the first 1 or 2 months. And these people, I'm not sure if you're aware of it or not, because some of the patient who end up in the ICU, they got better, they went home, they come back in a week having a blood clot somewhere in their system and they pass away from that. Some even come back with infection in their bloodstream called sepsis, and they pass away from that as well, even though they got better from COVID already. The doctor said, oh, your lungs are fine right now. You don't have any more infection in your lungs. Everything looks good. Your blood test looks good. You can go home today. And then in a week, they come back sicker. So I do not think COVID is a joke. And we do have in the United States, and actually in the ICU, in some hospital, Omicron variant can actually cause people to suffer a big deal. They die from it. We have seen people who have died from it.
Even if they're vaccinated?
Well, it depends. If they're vaccinated, the chance of dying is very, very low. Well, now, there are those people who are not responding to vaccines, such as those who receive immune suppression medication for treating their disease, such as if you have SLE or you have rheumatoid, you are a recipient of organ transplant, which you have to take the immune suppression lifelong. Well, it's called immune suppression for a reason. It suppresses your immunity. So when it suppresses your immunity, you give vaccine, you won't respond. If you don't respond, well, how can you fight off the COVID when you actually get it? So this is a thing that, well, if your body cannot respond to the vaccine, we have other means, but it's not 100% protective. So all we have to make sure that the public knows is to vaccinate other people around them so that the other people will not get sick. And when they don't get sick, they have a lower chance of transmitting the virus. When they have a lower chance of transmitting the virus, we can actually save these people, right? It's not treating your own self, you're treating the entire country and treating people around you as well. So this is a responsibility for everyone.
I would like to ask one more question. How many boosters do we need, Ashley?
Well, I think right now it's pretty hectic, right? Because there are a lot of vaccine platform in Thailand, and we know by now that the best vaccine is mRNA vaccine, the Pfizer's Moderna. As of now, we have a lot of data. We have more data than any other vaccine. That is very good. But Thailand did not have the mRNA vaccine for people initially. They have other kind of vaccine before. So that's the reason why we have a lot of booster jab here and there, so that we can catch up with the data that is most effective in the mRNA vaccine that you have to get. Now, moving forward into the future, I think that the COVID may become endemic, and that you can predict when it's going to happen and when you're going to get booster. I think it may be you need only one booster a year. You do not need like every 3-4 months, something like that. But right now we are just learning about it, and they're just flooding of information about all this vaccine. And don't forget, the COVID vaccine that we're using right now stems from the Wuhan variant. That's not updated, right? But
that's
it's
not
still protective.
Omicron.
It's like an old version, right? We need to
It's an old
update like
version, but it's still,
computer.
yeah. So we need more of the advanced version of that.
Right. Yeah. Too bad that we have a very limited time. Dr. Thani, maybe like we would like invite you to be our speakers again. But today, really, thank you for today. Thank you for being here with us.
My
สวัสดี
pleasure.
ค่ะ
Thank you.
ขอบคุณมากครับ
สวัสดีค่ะ
ขอบคุณมากครับสวัสดีครับ